Our program, though, is based upon the idea that if the children cannot get to the dentist, if they are having issues with access, whether that's transportation, or mom can't get off of work, or dad can't get off of work to take them, whatever the issue may be, or they can't find a dentist in their area, for example, that accepts Medicaid, which is a significant issue in Georgia. If they can't get to the dentist, then the dentist comes to them. Our program started and has been operating continuously since 1994. We started out with one mobile vehicle that went around to schools, typically within the local Atlanta region. As of today, we're running 15 vehicles. We currently are in approximately 850 schools across the state, about 80 or 85 school systems. At the same time, we also have about 100 non-school sites that we also visit at different times during the year.
We find that if the child that visits the dentist at an earlier age has fewer decay in their baby teeth, which will translate into less decay in their adult teeth. The child's first permanent molar comes in at age 6, and it can decay very quickly and may need pulling by age 8. So it's very important for children to have early dental care.
Whenever a child does not get routine dental care, you start having all kinds of problems.
Well, unfortunately, if you don't receive regular dental care, then you could have cavities. They could go untreated. Cavities are not actually going to cause pain until they get quite large. By the time a child has pain from a cavity, typically it's time for the tooth to be extracted or to be pulled.
What we found over the years is too many parents look at the dentist the same way they look at the doctor. You don't go to the doctor unless you're sick or unless something hurts. So many parents don't take their children in for the routine every 6-month visits to prevent the problems from occurring, because they think, well, if he's not hurting or she's not hurting, must not need to go to the dentist.
There have been studies that have shown that there may be a possible connection between some systemic diseases and periodontal disease. Periodontal disease is an infection of the gums that's in the bone that support the teeth. So sometimes diabetes, you might find that a person that has diabetes and periodontal disease, the periodontal disease will make their diabetes worse, more difficult to control, and their diabetes will also have an effect upon their periodontal disease. So it is important for adults and children alike to get examination at regular intervals.
A lot of parents don't necessarily understand that what happens to the baby tooth can also affect that permanent tooth. That permanent tooth is right under it. And we have had times in the past with children where the rot in the baby tooth is so bad and so extensive and has been there so long that the damage has gone down into the gum line and has actually started destroying the permanent tooth as well. We go to a school for the very first time ever. We've never been in that school before. Looking at the children that sign up for our program that we see, we estimate about 75 to 80% of them, round numbers, have probably never been to a dentist in their life.
It's great to have an on-the-spot service for this area. It's hard sometimes for our parents to get out to the dentist, and to have someone come in and give that support that's needed for our community is absolutely wonderful. They come out about 4 times a year, always right in front of the school, and the kids really enjoy it. The parents appreciate it. We appreciate it at our school, so we love the support.